allergies are not something to sneeze at because it really impacts your overall lifestyle. The birch trees that are outside or the ragweed release millions upon millions of pollen grains every day, and you get exposed to that, and that's what causes the allergy. So there's not really an appreciable amount of that type of pollen in the local honey. So you're not magically fixing the problem. You get a tasty treat that helps with a sore throat and a cough for those who are 12 months and older. So it really should be marketed that way rather than saying it's going to cure your allergies.
Some ideas just refuse to die online. You mentioned about the home allergy testing. That could be one of them. But what is like allergy myths or misconceptions that you just wish would disappear because maybe they cause harm, they cause fear? What would those be?
There's also the issue related to egg allergies and flu vaccines. We used to be very cautious about it, but we know that the amount of egg protein in it for the vast majority of people can safely get those vaccines.
Welcome back to the show. If you are tuning in, you are watching this on our YouTube channel. Thank you so much for being here. And remember, if you love this channel and if you love the podcast, hit that subscribe button, share these videos, because that is how more people discover Pete's Doc Talk, and also how more people can get in tune to all this amazing education that we have coming your way. And I get to have the most amazing conversations with guests I've never met before, guests I know nothing about, and then there's guests that I know so much about because I follow them online. And that is today's guest, Dr. Zachary Rubin, a double board certified pediatrician and allergist immunologist who practices at Oak Brook Allergists in the Chicago area, a nationally recognized medical educator and public health advocate. He shares evidence-based, accessible advice on allergies, asthma, vaccines, public health with over 4 million followers under the handle at Rubin_allergy, which I'll be linking in my show notes. And Dr. Rubin earned his medical degree from Case Western Reserve University, completed his pediatrics residency at the University of Illinois College of Medicine in Chicago, and his allergy immunology fellowship at Washington University in St. Louis. If you're not familiar, going to become a national double board certified pediatrician and allergist immunologist takes a lot of time. And his new book, which I have here, if you're watching this on the YouTube channel, all about allergies, everything you need to know about asthma, food allergies, hay fever, and more, is out now. I feel like I have my own talk show when I hold these books up. And I'm so excited to have you here today. We're going to be talking all about allergies, everything you need to know about asthma, food allergies, and more, and also just about your journey becoming an online educator. Thank you so much for joining me today, Dr. Zach.
Thank you so much for having me. I'm really excited to be here.
My first question for you is, you are like, anytime there's like a news story that goes up, like, you are like the first person to create a video. And I'm just like, it's like a running joke in my team. I'm like, listen, I don't have time, but Zach will probably get something up and then that'll be great and I can share it. So how has this evolved for you? I mean, one, you were obviously a practicing allergist immunologist. You're busy. What made you want to get online? And also, what is your secret to like being able to like get videos out so fast? I love it.
Yeah,
I'm like,
yeah.
This is amazing.
All right, I'll spill the beans. So basically what happened was I finished my fellowship right when the pandemic started. So I moved from St. Louis to the Chicago area when everything was shut down. There were no events for me to meet pediatricians, internists, go to hospital events. All of it was closed. Everybody was just trying to survive. As you may recall, it was really difficult to meet people and to build a practice because I'm in a small private practice. So I decided to go to social media to connect with people. And I went on old med Twitter, when we were all chit-chatting there. I'm sure you remember that too. And I connected with a lot of people there, and I quickly realized how much bad information was being shared about the pandemic, about various health-related issues, something that I rarely used social media prior to the pandemic. And I kind of thrust myself into this as I was trying to build my platform, trying to build a practice at the same time. I had a lot of extra time on my hands to figure out how to do the whole process. As you know, it's a lot of work to come up with what you're going to say,
totally.
Content creation, everything like that. I mean, at that time, TikTok didn't even have an auto caption feature. You had to handwrite everything in. So it was a lot of extra work, but I gained a lot of those skills then. And also I have a background in video editing and audio editing back before it was digital, because as a kid, I used to make home movies. So I knew how to edit VHS tapes. And so that was built into my DNA, so to speak, at a young age. And so that helped me become very adaptable to technology. So about April 2021, there was a medical student in Canada who asked me to go to TikTok to start making videos. And I was like, I
Mm.
don't know if I could do this because it's a dancing platform. I thought it was for kids. I had no idea
Yeah.
how many professionals were there teaching people. So when I started creating content there, people really resonated with it. I was creating things that was just succinct, trying to explain these different concepts. And it just has slowly grown over time that when you post almost every day, you will build an audience. And
Yeah.
I've gone around the country and in Canada and give talks about this, about how anybody who's a professional can make a difference on social media because we already have the expertise. We just got to put ourselves out there and break down the barriers between patients and physicians by just talking with people where they are getting their information. Most people are online getting their info. And so when I see news information coming out, I have all these push notifications on my phone.
Very cool. There
So
we go. Yeah.
so it
Yeah.
will tell me immediately that there's breaking news about something, or I still look at Twitter from time to time for video clips that are being posted by our Health and Human Services Secretary, as an example, to see
Hmm.
all the unusual things coming out. And because I've been practicing at this for a long time, I have my own system in place that, even before this call, I found a breaking news story and I was able to make a piece of content in 3 minutes. It's
Amazing.
very, very quick in how I
Yeah.
do it, from the idea to speaking to then doing it. Because when you do something over and over again, you have these scripts in your head, and you know that because you talk with patients every day. That there's
Yeah.
certain pieces of information you want everybody to know, so you already have that built into how you talk with patients. And I found that social media has made me an even better doctor because I can communicate with my patients a lot more clearly, concretely. I already built a rapport with most of my patients because most of them follow me before they even meet me for the first time.
Amazing. Yeah.
So it really helps on so many levels. And I'm really grateful for these opportunities.
Oh, and I'm so glad that you're taking the time to talk to me about that and sharing this trade secret of the push notification because that's the thing is like I'm like I get it through the grapevine or I'm not on social and then I'm like how did this happen and then I'm like I really am like I'm in the middle of something else or doing something and then I'm like Dr. Rubin will have that video and so if you're not following him which I'd be surprised because a lot of my followers do follow you follow Dr. Beach Gem we're all in that
Yeah,
sort of
we're in the same
trifecta.
circle. Yeah,
Yeah, right. We're, obviously larger followings on social. But, one of the things that I just really appreciate is, yeah, your ability to take that information, not make it scary and just really you're like your own news channel, right? Like I love it. I'm like, who needs mainstream media when we have our own platforms and Dr. Rubin giving us what we need? I love it.
yeah, yeah. I appreciate that. It's just that sometimes people need to get a little bit more nuance from an
Yes.
expert about whatever that news headline is. Because, yes, anybody could see that headline on the New York Times or whatever it is. But to get it from the perspective of a physician or a scientist, an expert that has more familiarity with it and can level with people is very valuable. And you do that very well with your platform when we're talking about various pediatric issues.
Yeah. And one of the fun things when I'm on TikTok, so I'm not as big on TikTok as I am on Instagram. And then I obviously have the podcast as my big mediums. But when I'm on TikTok and I see a video that I want to respond to, sometimes I see in the comment section like, oh, Dr. Rubin had a video responding to this. You should check it out. And I'm like, they're amazing, amazing. We're here. And I say we is that, because sometimes I'm not able to create a video. Sometimes you may not be able to, although
Hmm.
I haven't seen that happen yet. But like I'll be like, you know what? Let me just share his stuff. Like that's okay. I'll just
Thank
share
you.
it. And then I don't need to do it. And it's just a nice team effort to approach. Like you said, we have this awesome skill. I always joke with a lot of people when I do speaking engagements that I think that this should be its own subspecialty, like being an online content creator as a health professional because of the stuff that you learn just by going through it. It's like its own art form, its own
Yeah,
specialty to be able to communicate effectively online. And I think you
right.
have that. So, we're living in a moment where parents are flooded with all this health information, misinformation, but also a lot of fear, right? And you mentioned that beautifully. What pushed you to write all about allergies right now? Like, what was that sort of impetus to say, you know what? I want to create this book that people can have?
Yeah, so I got contacted by one of my followers who is an editor at one of
Nice.
the imprints of Penguin Random House and said, I'm looking at the market and there's really nothing out there that's a comprehensive allergy book. And I personally suffer from allergies, and so does my child. And so it was a big ask that initially brought this all forward. And I This was a couple years ago. So this is not something that
Nice.
just happened overnight. And I remember sitting there thinking, I don't know if I have enough time to do this. I've never written a book before. I'm very nervous to put myself out there. And my wife was saying to me, if you don't do this, I'm just going to ghostwrite your book for you. You have to do
Yeah.
this. And when she said that, I said, okay, you're right. I should do this. I'm going to put the time in. And after, working with an agent and figuring out the whole book proposal process,
Yeah.
that's actually the hardest part, is
Yeah.
coming up with the idea and putting that in a document that sells the book before you even write the book.
Yeah.
That was the hardest part. And so once I got that out there, and I had tremendous help from my agents on that, we got offers very quickly for the book, because it really is a need. There's really not much out there that is meant for the masses to learn about these allergic diseases for kids and adults, whether it's asthma, food allergies, eczema, chronic hives, medication allergies, even vaccine allergies I talk about in the book. All of these topics to put in one resource is really a culmination of all the content I've created over the years. So once I started writing the book, I made it a part of my daily practice. I'd write every day, and it came naturally. It was really a joy to write it. And I had a tremendous team at Plume, which is the imprint I'm working with. They did such a tremendous job with editing it. My editor was amazing, just really let me take the reins on everything. So this is really a labor of love to help people meet them where they're at. And there's so much that we can talk about with this book in terms of normalizing these conversations and debunking misinformation and how to navigate healthcare, that I'm very excited to share it with the world.
Congratulations. I am actually in the book proposal process, so I can attest to the fact that it is a very arduous process. It is the hardest, and that my agent said the same thing. But there is a joy of getting into it. And I used to write a lot when I was growing up. Like, I'm talking like fiction. In like high school, I was a
That's
very good
awesome.
fiction writer, but I never wrote a book like this, right? I mean, it's different. And
Mhm.
so, and also, we've gotten so used to speaking to short form content, and so having to like write for a book is very different for me. So like, I'm so used to writing my YouTube scripts or writing something for social that I'm going to say, and then I was like, oh, I can expand a little bit more. And
Yeah.
so it's really exciting. I'm really excited for you, and I love, obviously, not only the fact that it was an area that was needed in the book market, but also your reputation as someone online is super helpful, because people trust you. And so I'm really excited. I'm excited that people can get this into their hands. And my first question about the book is, you've been practicing through the pandemic now. And so families today often arrive already overwhelmed, as me and you both know, before the visit even starts. So when parents walk into your office today, what are they most anxious about when it comes to this topic? Allergies, asthma, or immune health? And has that changed from when you started practicing?
Right. So when I started practicing, a lot of the anxiety was towards the pandemic
Mm,
and managing food allergies through it, as well as vaccine issues. So in my area, there are other allergists, but in our specialty, one of the things that we do is adverse reactions to vaccines. That's part of our specialty. And so I became one of the de facto experts on dealing with these different issues. You may remember early on, there were cases of anaphylaxis with the
yeah.
COVID vaccine. There were cases of COVID arm, right, with the Moderna vaccine and those large local reactions and all these changing guidelines. So I had a lot of anxiety towards, all right, is what I'm experiencing a real serious reaction? Do I need to get a booster? What do I do with that? And so that was a very difficult time, because we were
Yeah.
essentially building the ship and driving it at the same time. So that was challenging, and I was collaborating with a lot of experts, which social media helped me connect with various experts at Harvard, as an example, and we were creating patient databases and really trying to figure out like what was going on with these vaccines in terms of adverse events. And then as things started to settle out, we had a lot better understanding about what was considered to be a true serious adverse event versus something that was less worrisome, and how do we manage it. But that took time. So that issue has not been a major topic of conversation in recent years. I would say a lot of the anxiety that my patients face are more geared towards food allergies specifically. So
Mm,
they'll come in already either with a diagnosis of food allergies or suspected from their pediatrician, or they come to me directly because they know who I am, or they're looking for me as a second opinion, because one of the big issues when it comes to allergy testing is it's not always the most accurate form of testing depending on how you use it. And I talk about in the book in detail about sensitivity, specificity, pretest probability, and how does that impact our testing strategies for allergies? Because the adage that I learned in fellowship is sensitization does not equal allergy. When you get a
Yeah.
positive test, that only means you have an antibody present called IgE or immunoglobulin E that could bind to that specific substance, like peanut butter, as an example. And maybe that could lead to an allergic reaction, but it depends on the context of the test. If I was to test 4 people in a room, 1 to 2 of them would have a positive test, even if they're eating the food, if we do a full panel. So full panel testing is not necessarily helpful when it comes to food allergies, yet I have that coming into my office on a regular basis where people had a panel test done 10 years ago, and now I'm stuck with a laundry list of food allergies that may or may not be real, or maybe it's too late to intervene, and it becomes very difficult to tease that out and figure out how can we make someone's quality of life better and safer.
Yeah, and I think you just said it. Like, there's a lot of mislabeling that I think parents do, or for themselves if they have these situations, or for their child, between the differences of allergy, intolerance, or
Mhm.
sensitivities. Do you go over that in the book? And if you don't, or if you do, if you want to just give like a little bit of like, you know, high level sort of how to differentiate for a family and why it's important for us to know that it's different. And I think,
Right.
part of, like, for example, my our nanny has a gluten intolerance, right? And so
Mhm.
my son says, "Oh, mommy, she's allergic to gluten." I'm like, "Well, let's use the right terminology." And I'm explaining to a 6 year
Yeah.
old, but
Yeah.
I'm like,
It's hard.
it's important for me. Like, I'm like,
Yeah.
I want him to understand, although I know he's not going to retain that probably right now, that there's a difference, right? And
Right.
also that just because you don't like something doesn't mean you're allergic to something. And I say that
Exactly.
because we should never be diminishing what a true allergy is. So yeah, explain that sort of difference between allergy, intolerance, and sensitivity. And maybe it has to
Yeah.
tie into like blood work, or, how someone responds.
Right. So in my food allergy chapter in the book, I go over this in detail in different ways. So I actually have a screenplay that I wrote, a fake screenplay, because when you go on social media or you see SNL skits, they commonly make fun of this, where somebody
Mm,
says they're allergic to a food and they're at a restaurant, they get a plate, it accidentally has it in front of them, they still eat it anyways, and they say, "No, it's okay. I just have a little bit of intolerance." Right? So having
mhm.
that language is so important. Allergy is not a catch all term. It is an abnormal immune system response to a foreign substance, but even within that, there are different subtypes, and I go over several of them, whether it's a classic IgE mediated food allergy or something called food protein induced enterocolitis syndrome, like
Yeah.
FPIES, or eosinophilic esophagitis, or EOE. Those are all not the same, but food can trigger symptoms through different ways the body works, whether it's normal or an abnormal pathway. So when we talk about food allergy, most people refer to it as an IgE mediated allergy. That's when you have a blood test or a skin test that's positive. And even at tiny doses, if you eat it, you could have mild symptoms, or you could have potentially serious life threatening symptoms called anaphylaxis. And we try to prevent anaphylactic shock, which is the true life
Yeah.
threatening situation. I go over the difference in my anaphylaxis chapter between anaphylaxis and anaphylactic shock, because they're often used interchangeably, but they are not the same. They really are not. So if I get a test that's positive for peanut, and they have a history of either hives, swelling, problems breathing like wheezing, repetitive coughing, vomiting, or a combination of those symptoms, or even in rare cases, a drop in their blood pressure, and it's reproducible even at small amounts, that's a food allergy. Versus an intolerance is a digestive problem. You
Yeah.
eat something even at larger amounts, and you don't have the right enzymes or the right bacterial milieu to break that food down properly. And if that happens, you could get a lot of excess gas production in your gut. You could have pain. You could have diarrhea, sometimes even nausea. That's what an intolerance is. And the testing is not really widely available. There is something called a hydrogen breath test. I never order because it requires somebody to consume the offending food, milk, for lactose intolerance, sit there for a while, breathe into a tube, because if you have an intolerance, you make excess hydrogen gas from the bacteria that are trying to make up for the fact that you don't have an enzyme called lactase to break down the sugar molecule lactose. So we're going to cause harm to prove a point. I don't like doing that with testing.
Yeah.
Right? I try to minimize harm with anything that I do. So clinically, if somebody already tells me, yeah, whenever I consume this particular food, it always gives me this problem and it's bloating, abdominal pain, whatever, I'll say, hey, let's avoid it for 2 weeks. Let's see what happens. And if your symptoms go away, great. If you put it back in your diet and it comes back, that is diagnostic. That's a clinical diagnosis. On the other hand, sensitivity is a non-specific term. And it's very challenging to try to rewire people in thinking about this because it is true that food can cause symptoms. There's no doubt about it. We know many different ways that it does. But to be able to say that somebody is sensitive to a food that when they eat it, they start having headaches or having other symptoms that are not in a specified pathway, I don't have a test to prove to that person that this is why it's happening. I have to go based off the clinical history. So there is something called non-celiac gluten sensitivity, where they may not have the classic intolerance symptoms, but they have other non-specific symptoms and they test negative for celiac disease. But they swear that every time they eat gluten-containing products, it has a problem. And then when they stop eating it, they feel much better. I believe my patients, but I don't have a test to corroborate that is the major difference. What you see online, though, are people selling food sensitivity tests, which most of the time they're measuring for an antibody called IgG. That is something we naturally make in response to seeing food in our body as a way to decrease that immune response. So how does your body know that food is not a germ? It has to have checks and balances, and IgG is one of the ways. But the tests will say, oh, if you have a positive test, you should get rid of that food. Well, everybody who comes in my office as an adult with that packet, with that test, they're all positive for coffee because almost everybody drinks coffee. So anytime you're exposed to something, it just says you're exposed to it. It doesn't mean anything clinically.
You know, we already brought up one thing about the blood work. You know, as a general pediatrician, that first line for a lot of families, there is an obsession with the blood work. And you already mentioned that a lot of the blood work may not always be accurate because of testing strategies. And so a lot of it is collaborated or connected with the clinical picture. Do you see that sort of sentiment too, that people are obsessed almost with like, I want the documentation, I want the blood work, I want some sort of test to confirm this, or you're able to kind of explain them out of it in terms of, hey, it has to do with this whole picture of everything that we're seeing?
Right. So when people come in initially, if they don't know me or haven't talked to me before, they will initially say, I want these tests.
Yeah.
And this is why it will make me feel better. And so I'm lucky that the way that my practice is set up, that I have a little bit more time with my patients,
Nice.
which I'm very grateful for that because it gives me the opportunity, just like we are right now, having a little bit more of a deeper discussion into the risks and benefits of testing. We often online get demonized as saying we don't give informed consent, and that is far
Mm,
from the truth. And I
yeah.
do that with testing. And so I always encourage people, hey, if your doctor, your PCP is going to order a test, ask them why are they ordering it, how accurate it is, how is it going to change my management, and what are the risks and benefits of doing that test? Because it can cause anxiety, it can cause unnecessary testing, it can cost money for people.
Yeah.
So I always am very sensitive to that because as just to give you an example, when I order one IgE test for a specific food, if it's a blood test, the lab I get it through, they charge about $30 per food. So you can
Mm,
imagine if you're doing a panel, that's going to be hundreds, if not thousands of dollars for people, depending on how
yeah.
many foods they want to put in there if it's not covered by insurance. So I really try to break down the risks and benefits of these different tests. And most of the time, people actually will say, oh, you know what? I think you're right. Because my goal, as well as I'm sure your goal is, we want our patients to feel better, to be healthy, but
Yeah.
we don't want to give them more problems than when they come out, right? We want to clarify things that we know and also be humble and say, hey, you know what? I'm not exactly sure what's going on here. Let's get more data. Let's get more time, get a little bit more history and information. And I strongly encourage pediatricians and internists to do this whenever they're faced with an adverse reaction that's an allergic reaction. There are many times where you have a one off situation and you may never be able to explain why that happens, and then it never happens again. The
Yeah.
reproducibility really helps. That if unfortunately if a reaction happens again and again, you can then write down what was going on and keep that and bring it to the doctor and say, hey, I noticed that when I eat these three things, this happens pretty quickly and it's happened multiple times. Okay, let's look at that. Not, a whole blanket full of testing. It's like looking for a needle in a haystack. But when you look for that needle, you're poking yourself along the way, and it could be permanent damage potentially.
One thing that I listened to that really struck a chord with me is the fact that you mentioned that you have time with your patients, right? And I think that that's the beauty of being online, like you said, right? We're able to have these conversations on the podcast, but also you're able to explain in like a video, or if it's a little longer than 3 minutes, that social, like that Instagram can allow, this nuance, right? The explanation, the why. I think so many parents feel disillusioned, feel upset by the medical system because of the fact that many doctors do not have the time nor take that moment to like explain. And as a general pediatrician, I'm not saying that, oh, you need to spend all the time, but because I know there's a systems issue here, but
Right.
how much can we help and solve just by being able to explain what you just said, right? That, hey, here is
Yeah.
why I'm doing this, this testing. Here is why I'm not. What are your concerns? What are your comments? As a gen peds, what I usually get is that family who comes in with a rash or something very non-specific, like, and they're like, I want to do like that pan testing. Like, can you just
Yeah.
test for things? I'm like, well, that's not how testing works, but tell me more. And that meant as a gen peds that I would run late. I don't have
Yeah.
as much time with my patients. But then I
Right.
think about how much we could help our patients, and how much they wouldn't go to alternative clinicians, clinicians that don't have our evidence-based education, because they're feeling seen and heard. And I'm sure you feel the same, that if we just had that moment to explain, to, debunk myths with our patients in our office, that they would feel more confident and supported when many times they're not.
100%. I mean, the problem that people may not realize is that in primary care, or even in a specialty like mine, I have in a little bit of kind of both worlds, and I'll explain in a second.
Mhm.
But when you don't do a lot of procedures, you have to rely on seeing a lot of patients to keep the
Yeah.
lights on, because the insurance does not reimburse well for just an office visit. And so people need to remember that you see patients, but then you have billers and coders, you've got secretaries, you've got nurses, medical assistants, office managers. Like, you have to have everybody paid for their salaries. You rent a building out, you have equipment fees. If you have vaccines in your clinic, or I have allergy injections in mine, you have a lot that you have as overhead. And so if you don't have some type of procedural work going on, it's harder to be able to spend more time with your patients. And that's the sad reality of the system, that it does not prioritize preventive medicine by being able to reimburse the time that you spend properly. And what people don't realize is we have so much documentation to do on top of that, and fighting with insurance companies, that it
Yeah.
causes quite a bit of burnout. And we've seen a huge shift. I don't know if you know this, but my dad's a general pediatrician. So I
You
grew up
mentioned
with
that.
this,
Mhm.
and I saw the evolution of medicine throughout my entire life, that's really helped me appreciate what I'm doing now, but also what it was like before. Because there were no hospitalists when we were kids. The
Mhm.
pediatrician did everything. They would, go to the ER, do the spinal tap, admit the patient to the hospital. They'd have a service where they'd round on their patients, go to clinic, answer calls while they were seeing patients, then go back to the hospital after the clinic and round again. And it was rinse and repeat. And so you had great continuity of care, but at the same time, it was not sustainable as the insurance changed, and things became much more different. And the hospitalist medicine filled that gap, and now we have a diversity in terms of physician assistants and nurse practitioners to try to help out, because we can't see enough patients as doctors and be able to give enough time. Can you imagine if we didn't have nurse practitioners or physician assistants, how many more patients we'd have to see and how little time we'd have for them?
Yeah, and also, I mean, I've seen it in Gen Peds. I don't know what's happening in the peds allergy world, but there's just been such a mass exodus of general pediatricians, and that happened after the pandemic.
Yeah.
I think most of my listeners probably know this, but pediatricians in general, do not make a lot of money, right? And so when you had the pandemic happen, the stress load, the expectations of documentation, having to see high volume, like you mentioned, and I dealt with that too. I was very burned out, and it was very hard for me. That burnout carries over into patient interactions, into family
Right.
life.
Right.
Burnout is not something that's isolated into a silo, and it was so hard to see. And I kept cutting back hours, and then I saw a lot of my peers leave the practice, or especially my my fellow mothers because, they would want to be, they're like, what is the point now? Like, I'm splitting myself between my family and my career, and it's like not worth it anymore from a financial aspect to be 1 foot here, 1 foot there. And that's a sad reality that just from the system that's kind of created, the lack of an ability to communicate, the insurance companies involved, the lack of reimbursement, we are losing such good clinicians. And it concerns me about the future of pediatrics, and I
Absolutely.
really am grateful to have you, other creators online that not only speak to the debunking, but I also got online in a way to reclaim our profession, right? Like, I
Right.
want us to regain trust in pediatricians, in allergists, all the people that are providing that sort of nuance, because like you said, we care about informed consent. We care about the child. We don't want to see your child because we have so many other children to see. We love you,
Yes.
but like, we
Yeah.
don't need it. We want you to stay home. We want you to be better. And I think it's such an important thing that parents need to understand when they, see what we're doing and what we're trying to accomplish. And I think that systemic issue of medicine is something that people don't always hear. And I think it's important for them to hear, to know that it's not the fault of the clinician. Like, we're trying our best.
Right. I totally agree. As an example in the allergy world for me,
Yeah.
that's a little bit different than pediatrics, is that we have seen an explosion of different therapies we can use over the past 10 years through something called biologics. And if people aren't familiar with that, those are antibodies that are grown in the lab that are specific to, one particular part of your immune system, as an example. And we have several of these medications that can treat severe asthma, severe eczema, even food allergies now. And it's booming across many subspecialties. It's not just allergy, but in the specialty world, we're expected to prescribe these medications, right? But what people don't see in the background is how much paperwork and time and aggravation it is to get these things approved that are not compensated. We
Yeah.
don't get compensated for all the work in the background to get these expensive medications approved by insurance companies, and the phone calls and the prior authorizations, that many people just refuse to do it now because
Yeah.
it's just too much work that is uncompensated. But it's such a detriment to patients that we have to have significant reforms in healthcare. And so, there's always a debate about, do we need to change to a nationalized system like you see in Canada or in the UK and whatnot? And I think it's very difficult in the United States when we have state laws and federal laws, to be able to get everybody politically motivated to change the entire system. And I hope that it does change. It needs to, because we're really on the brink of collapsing with the way that things are going. And right now we're in a system where there's basically a bull in a china shop with no plan to fix the damage that's being done. That's very concerning, but we don't need to get into that unless you want to.
Oh yeah, no. I mean, that is we should have another conversation about that on another show, but I think
Yeah.
that pandemic opened up the very fragile state of the education system and healthcare system in the United States. I've spoken about that on other shows as well, or
Yeah.
other episodes, about how it was always not good, and then when you had it all come to fruition and you're like, wow, this is really not great. And it's basically, it's teetering. Like, there's obviously, like, it's so close to collapsing, and I already think that it is collapsing because of the lack of patient satisfaction, the lack of clinician satisfaction. The two people that are the most important people in a healthcare system are not happy, And
Right.
so that's something
Right.
that's really important to me. How I want to ask one question about this because we're on that thought, and then I want to go back to allergy myths because I'm curious of your thoughts. But
Sure.
despite all of this, families still want guidance that they can rely on. From your perspective, what can we do as clinicians to help, or even content creators, educators, to help rebuild trust between parents and the medical community, knowing the system that we're in?
Right. I think we have to take a step back, and whenever we explain things that don't seem to make sense, always explain how there can be some good intentions in what's being said. And here's what the kernel of truth is, and
Hmm.
why this other piece of information is not true. And then also being humble about it, and being respectful about it. Because, there's so many different things out there right now that are just absolutely ridiculous. But if we come with the same level of ridiculousness and disrespect that we're being met with, it's going to be harder to build that trust back. So the way that we present that information, I think, is important. And just showing genuine care by being there as a regular presence, I think makes a difference. And it's something that I'm seeing in real time, that when I'm out and about in public now, I don't know about you, but I'm
Yeah.
starting to have people recognize me
Yeah.
in public. And it's something I never expected to happen in my life. But I was in Italy recently for the Olympics, and
Yeah, I saw.
I'm at a train station, and a mom comes up to me, says, "Dr. Rubin, I've been following you for a while. My child has food allergies, and you've made a huge difference." And so
I
you always
love
got to
it.
remember, when you're creating content, you are impacting people more than you realize. Even if you have 5 followers, 15, or 50 million, it doesn't matter the number. You're going to impact more people than you realize. And I tell this to physicians all the time when I give talks at different places in the country. It doesn't matter how many followers you have, because you will impact more people online than you do in your clinic. It's just, the metrics always are true of that. I mean, I
Yeah.
could see 20 patients in a day and give them good care, but I can put one post out there and 500,000 people will see it.
It is a powerful medium. Like I agree with you, and that has started to happen a lot more for me as the platform grows, of course. And it's a very humbling experience when it happens, and I think that's why you're doing so well on the platform, is that the people who do well on social also are very humbled and grateful for that reality, right? Like when that person comes up to me, it's not, oh yeah, it's me every time. My husband, even when my husband's with me, I get a little bit shy, or almost like, wow, like thank you so much, or get a little
Hmm.
teary-eyed of like,
Hmm.
thank you so much for trusting me. Like
Yeah.
I'm so grateful for this platform. And yeah, for me, the other day we went to dinner, and there was a woman who was like starstruck, and the starstruck moment, I'm just like, no, no, no. And like she got teary-eyed seeing me, and she was like,
Yeah.
she's a grandma, and she was like, hey, like you have helped me so much be a better grandma or nana, like she at an Italian restaurant.
Oh,
And
it's
I'm
so
like, thank
nice.
you so much. And like, she was
Yeah.
so emotional. And I was like, I got emotional because I'm like, listen, I just do it like you because we love it. And it has its own ups and downs, as we both know, right? We deal with a lot of negative commentary, a lot of
Yeah.
anger, a lot of the algorithm, nonsense that we deal with. But at the end of the day, how beautiful it is that we can impact millions around the world. And like,
Right.
I cannot, and you're in Italy. That is so random. I think you shared that on your story, that you were like, you got approached. That is so wild. And that must have
Yeah.
made you feel humbled and also just really proud of the work you do. I love that.
I'm so proud of what I've been able to do over the past 6 years. My
I
wife
love
also
it.
creates content. She's an immunologist
Yes.
and inventor, and she's amazing. And so it makes for fun conversations at the dinner table
Yeah.
about the different things that we experience. And I just love being a part of this team. I feel like you and I are on the same team. There's several
Yes.
others that do this, and it really is meeting people where they're at. And I think the reason why people kind of are grateful for it is the fact that, as we mentioned earlier, we don't have enough time to be able to go over everything in clinic. And oftentimes people will leave and then they have 20 questions that they
Right.
forgot to ask, or didn't have time or chance to do it, or there was a lot of distractions if they have kids in the room. It gives an additional opportunity to learn from somebody they trust, and trust is more valuable than any amount of money that you could have. That
Yeah.
is the most important thing in life, is to have that. And I'm proud that um, I have a platform. I'm proud of your platform. It's just amazing the kind of work that we can accomplish in a digital space.
You mentioned earlier in the conversation how your online work has really translated into being a better clinician in the office. What about that experience online translated to those changes that you saw? Like, is it the fact that you listen more? Is it the fact that you're able to communicate better? I'm very curious on how that has translated to your inpatient experience.
Yeah, so there's a couple ways that it's improved my practice. One, as you mentioned, is communication skills.
Hmm.
So it gives me time to practice outside of the clinic, to then use those skills of,
Yeah.
how do I take a complicated concept, distill it down to something that is bite-sized, easily understandable for as many people as possible, and share that with people. And also doing it in a way that not only tells you I'm certain about X, but uncertain about Y, whatever that may be. It's really important to show that level of empathy, and helping people understand that sometimes we have to live in the gray zone. That is so important. That the confidence and the absolute certainty, it's not good medicine. We don't
Yeah.
always have 100% confidence in the decisions that we make. So the communication piece, when you practice over and over again, makes that a really good experience. I also learn from the people asking me questions online that I
Same.
may not have thought about, right?
Yeah.
There may be a very specific nuanced question that you don't always encounter in clinic, but then you'd be surprised that like a couple weeks later, it comes up in your clinic. Or on the other hand, the misinformation online. I've had patients come in believing something because of what they heard online. And because I knew that existed, I knew how to combat it better rather than being caught off guard and saying, wait, there's people
That's not
selling
true.
nasal iodine sprays?
Yeah. Yeah.
Really? Like people are actually buying those products and not understanding that there's potential risks that we can't quantify yet, nor has it been properly tested for efficacy, right?
Yeah.
Uh, and so this is the same thing with the supplements and all of the different wellness trends. Like being aware of those issues help us guide conversations better. And then also, if you're online enough and enough people know you, when they come in as a new patient and they say, Dr. Rubin, I came because I followed you online. I'm not joking. I had a family drive from Kentucky to Illinois to see me, like an 8-hour drive to see me because they wanted to
Amazing.
get my opinion on something. And I'm forever grateful for those experiences when people will fly or drive to see me. I even had a family give me a hula hoop from
Oh,
Denver.
yeah. We didn't even get to talk about how an amazing of a hula hooper Dr. Rubin is, by the way. You should probably, if you follow him, you know. I love seeing doctors be humans, by the way. This is like the best part about social, right? Like
Yeah.
this
Yeah.
humanization of like the interests that you have. Like right now, I'm a Lego builder. I love dancing.
I saw
I
the
love all this
Legos. I
stuff.
love
I'm
Legos.
I'm obsessed. I have like
Yeah.
a few on my bookshelf right now, but like I love that. That again, adding the personalization of the doctor online I think adds more trust, right? That, hey, I'm human. I have the same feelings. I understand why you might be scared of this. Like, this is not me talking from above you, it's talking with you
Right.
and making this a team effort. And I love that.
Yeah, we don't live in ivory towers. We
Yes.
are everyday humans. And so the hula hoop was something I started early on in my content creation because it was a talent I developed as a kid. I actually used it in my college admissions essay to
I love
basically
it.
explain how if I put my mind to something, I will accomplish anything, even if it's as trivial as a hula hoop. I taught myself how to do it as a 9-year-old and
I
became
love
good
it.
at it. And it's fun. It's a good form of exercise. It encourages people that it's okay to be weird. You can be a doctor
Yeah.
and be a little edgy, a little eccentric
I
and
love being
dorky.
weird.
Yeah, me too. I play video games. I love Legos. I hula hoop. I've got 3 dogs. We got fish. Like my wife and I do all sorts of crazy things. We're having fun. We work hard and play hard,
Yeah.
and
I
that's
love
not
it.
something that you necessarily see if you just see your doctor in the stark white sterile room, right? Like you don't get that. If and you and I don't wear lab coats. Like I hate
Yeah.
that. I think
Me too.
it's something that it scares people in my mind, and I
Yeah.
get it. There's reasons to do it and all that, whatever. But I'm always about meeting people where they are at and making sure that people feel comfortable because the bottom line is we get the utmost privilege to hear people's stories of all sorts of issues that they're facing from a health standpoint, right? And so to have them open up will make our jobs that much easier to develop a stronger differential diagnosis, to understand if they're even taking their medications correctly, if they're going to admit that, right? So having that ability to bridge, build a bridge, to build the rapport, and have these deeper discussions, it is priceless.
Mm. I love it. And again, I'm just so excited about your book and going back to, the allergy conversations. One question I will have for you, so just start thinking about this is what is your favorite chapter? Okay. But before that, because you have to choose a favorite chapter for me. Before that, I want to talk about some allergy myths that you wish would die. Obviously, some ideas just refuse to die online. You
Of course.
mentioned about the home allergy testing. That could be one of them. But what is like one or two or maybe three, if you have them, allergy myths or misconceptions that you just wish would disappear because maybe they cause harm, they cause fear? What would those be?
Right. So the low hanging fruit, so to speak, is the local honey treating allergies. That is something
Okay.
that I talk about in the book. The first time I ever heard that was when I was in New York. I was applying for fellowships for allergy, and my aunt picks me up and she goes, "Oh, so you're going to be an allergist? You should tell your patients to eat local honey." And I said to myself, "Huh? Like, what do you mean by that?" She's like, "Yeah, I was told that if you eat the local honey, you have this pollen, and it's kind of like allergy shots." And I was like, "Oh, that kind of makes sense." Now remember, this is me being a pediatrician, not an allergist yet. So like
Yes.
I had never heard about this. It sounds plausible on the
Mm-hmm.
surface, but then I realized like one of the cool things about my fellowship is we would take nature walks and we would learn about the different plants in our environment. I was in St. Louis, so we go to Forest Park, and it was a lot of fun meeting up with some locals who would teach us about the forestry and the different trees, and it helped us kind of conceptualize the recommendations we make from an environmental standpoint. And one of the things I learned early on was there's something called Tommen's postulates that explain why we are allergic to aeroallergens. And some of the postulates explain you need to be exposed to the substance in large quantities, and it needs to be easily released in the air. So when you think about local honey, the pollen that's actually in there is from insect pollinated plants. They're heavier, stickier pollen grains. You don't smell those on a regular basis. You don't get exposed to it. But the birch trees that are outside or the ragweed release millions upon millions of pollen grains every day, and you get exposed to that, and that's what causes the allergy. So there's not really an appreciable amount of that type of pollen in the local honey. So you're not magically fixing the problem. You get a tasty treat that helps with a sore throat and a cough for those who
Right.
are 12 months and older. So it really should be marketed that way rather than saying it's going to cure your allergies, because, and I joke about this, but allergies are not something to sneeze at because it really impacts your overall lifestyle. If you can't breathe through your nose and you're itching and you've got watery eyes, you got red eyes, you got rashes, you're coughing, that causes difficulty concentrating, right? So if you're working, you can't work as well and you're not sleeping as well. And we all know
Yeah.
sleep is one of the most important parts of your health. It can increase your risk of hypertension. It can really shorten your lifespan if you don't sleep well. So it's all interconnected. You can have increased risk of ear infections and sinus infections if you have uncontrolled allergies. So if you're given a recommendation that seems harmless on the surface but delays proper care, and you end up with these secondary complications, where are we at? We're kind of stuck with it. That's why that needs to go away. And it never seems to go away, but I keep talking about it every year during this time of year. That's one. Another one, which is more niche but important for you and I working in healthcare, is a lot of hospitals, when they screen for people who get iodinated contrast dye for a CT scan, as an example,
Mm.
right? So that's the dye we inject to be able to light up organs to put. When we do a CT scan, we can say, oh, I can see what the lungs look like better, or the kidneys, or whatever organ you want to look at. That dye contains iodine in it. And in the 1970s, there was a case series that reported an association between shellfish allergic patients and having reactions to these dyes. And at that time, they thought, oh, well, I guess if you have a shellfish allergy, you can't have iodinated contrast dye. And so there's these screening tools that are still being used in many hospitals that will say, okay, do you have a shellfish allergy? Well, I don't know. Can you get this dye? Like, people are still confused about it. The reality is when you have a shellfish allergy, it's nothing to do with the iodine. It's tropomyosin, the muscle fiber protein that causes the allergic
Yeah.
reactions. So that association's been tested out and been debunked and debunked and debunked. And yet it still lingers. It's a very niche thing, but still, from a public health standpoint, from a system standpoint, and how our hospitals operate, they need to be getting rid of that because it doesn't make any sense anymore. It's a problem.
Yeah.
There's also the issue related to egg allergies and flu vaccines that we
Yes.
used to be very cautious about it, but we know that the amount of egg protein in it for the vast majority of people can safely get those vaccines. I can go on and on, as you know.
Oh, I love it.
There's so
I
many
know.
different things we could talk about.
Yeah, I think mine as a Gen Peds would have been the testing, like the home testing things. I know that's not a
Right.
myth, but it's more of a product situation. And then I think one of the biggest ones is that I'm allergic to penicillin.
Ah, yes. So
Right?
about
Like,
so
yeah, really, yeah. Tell me about that. Yeah.
yeah, so it's the most commonly reported drug allergy in the United States. Roughly 10% of people think they're allergic, but newer research suggests that if we test them out, about 90% are not actually allergic. And there are many reasons for this. One is you may have actually had an allergic reaction, but most of the time, after 10 or more years of abstinence, the allergy goes away. So many
Interesting.
people
Yeah.
outgrow the allergy. The other is there are people who avoid it because their parents are allergic. They think family history is a strong indicator
Yes.
of it, and that is just not true. Flat out false,
Yeah.
unfortunately. There are also situations where a baby gets a rash after having an amoxicillin, which is a penicillin-based antibiotic. And you sit there as a pediatrician and you're like, well, it's probably okay, but I'm not exactly sure. And the parents are very scared by this. It's easier to say avoid it and not think about it rather than challenging it and taking on an additional liability. On top of the whole healthcare system thing, which is it's not really reimbursed well. If you're going to do a direct drug challenge where they take in your office, you have to have nursing staff one on one with them and all that, and it's not always reimbursed by insurance. Like people have to pay out of pocket to like have that kind of a procedure done, which is a big problem, especially in like the private practice setting. But beyond that, there are many people who look at side effects of drugs and think that's an allergy. Like abdominal pain and diarrhea is not an allergy to antibiotics. It's an expected side effect because you're
Right.
killing off not just bad bacteria, but good bacteria. And so
And
this is a major public health problem.
I think a lot of the things is the rash that kids get, right? Like the rash that comes with taking an antibiotic. They think it's the antibiotic, but it could also just be, in my experience, also the virus that also came with that bacteria. So, for example,
Right,
ear infections, we know that the virus can cause it, but that rash is what I think throws a lot of pediatricians off too. And I think you
right.
probably agree with that. And so, what is it? Obviously, we know that a child who gets a rash could have an amoxicillin allergy, but is there a differentiation of that rash?
Yeah, so I do talk about it extensively in the book, so I want people to check it out.
Love it.
But what I think is important for people to recognize is the timing makes a big difference. So if you were to say that the child got amoxicillin and they finished their 7 or 9 day course, like however long you're prescribing it for, and then the rash comes a day or two later,
Yeah.
that's not an allergic reaction that we're concerned about. Sometimes it could be, but when we talk about the concerning drug reactions, the IgE antibodies, what we worried about. You can make IgE antibodies to penicillin and its breakdown products, like we call them major and minor determinants. That can cause anaphylaxis. That's what people need to recognize is the scary stuff. And so, if you had a situation where on day 2 of the antibiotic, 30 minutes after a dose, they get hives, I'm scared. I'm concerned. My hair is raising in the back of my head. That could be something that would lead to a problem and needs to be avoided. And then there's different classes of antibiotics we also have to worry about, like, okay, first generation cephalosporins, as an example. Like you have to think about some other things in addition to it. But the time, like I mentioned, the timing makes a huge difference. The characteristics of the rash may also help, and that's something that clinicians need to just be aware of, the difference between we see urticaria or hives and something that is not. And so the hives is what really is telling for a concerning reaction, as an example. And to make this confusing and a little muddied, though,
I love
is that
it.
there are
Yeah.
there are other types of reactions that are rare, but people need to know
Yeah.
about, like Stevens-Johnson syndrome, toxic epidermal necrolysis, or serum sickness-like reactions. Like there's different ways amoxicillin can cause problems, and in those situations, you always avoid it.
So one thing that I've learned from this conversation is that the world needs a book about allergies. Okay?
Yes.
And look at that. You're right because again, there's so much to know. There's so much to nerd out about, right? Like in terms of all this information that you're giving and sort of that, for whether you are suffering with any of these things, obviously asthma, food allergies, hay fever, or you just want to be educated. For me personally, I don't have any of these issues, but I can't wait to read it for my patients, right? Like I'm so excited for it to be a great resource for Gen Peds, anyone who takes care of children. What would you say is your favorite chapter? If you could choose one. I know it's like trying to pick a favorite child, but tell me the favorite
Yeah.
one.
Yeah. So I will tell you it's nearly impossible to pick a favorite, but what
Yeah.
I'm going to do just to put myself out there, I'm going to pick the hardest chapter that I had to write.
Very
So
good.
I have an entire chapter on mast cell disorders.
Mm.
It's something that's talked about a lot on social media. I see a lot of patients with various issues related to it. So the culprit cell that causes most of the problems for people who deal with allergies is the mast cell. It's part of your innate immune response, first line of defense against foreign invaders, but also helps with wound healing. So it's a jack of all trades, and it's found in various tissues in your body, from your skin to your gut, etc. And so some people make too many of them. We often call that mastocytosis.
Yeah.
It can live in your bone marrow, and in very rare situations can actually be a type of leukemia. There's mast cell leukemia as an example. I've never seen that, knock on wood, I hope I never do, but that actually happens. And then there are people who have mast cell activation syndrome, or MCAS. And that's where their mast cells are overreactive to benign stimuli, and it causes severe recurrent symptoms in multiple organ systems. So these are folks who have flushing and hives on and off. They have terrible abdominal complaints. They may have cardiovascular problems like postural orthostatic tachycardia syndrome, palpitations, chronic fatigue, anxiety, depression. So it affects many aspects of their body. And they have elevated markers. And being able to explain that in a chapter has been very challenging. I actually interviewed one of my followers who's now a good friend of mine, who told me her story, and I use that as the main focal point for the chapter. Because a lot of my chapters, I tell stories about my patients or followers I interviewed for the book, because that's how we learned in medicine. In modern medicine, we learn through cases, and we discuss those cases even in the first or second year of medical school. That's often done. And so I give those stories, and then I bounce back between what we know about it, what we don't know about it, the challenges with diagnosis, the challenge with management. It was the most difficult chapter to write, but also gave me a lot of joy writing it, because I know a lot of people were desperate to have additional resources. And so I was very happy to provide that.
I love it. I'm so excited about your book being out there. Congratulations.
Thank you.
What is something that you're just really excited about and looking forward to in your life or professional life? What's going on that's making your heart happy right now?
Oh, well, I just came back from Italy and the
Love
Olympics,
it.
and it was amazing to see the diversity, the culture. The food was amazing, the architecture, seeing elite athletes, and just what inspires me about the Olympics is that you see people who are dedicated to a craft, and they are at the highest level in the entire world. They work so hard to get to that point. And then I look at myself and I say, I spent my entire adult life to become a doctor. And now I'm spending a lot of time in the space of medical education digitally. And so it really makes me think about how grateful I am to be in this space and to have worked as hard as I have, that I get to celebrate all of those accomplishments, recently and over the next couple of weeks with the book launch.
I'm so excited for you. And thank you for sharing your story about the Olympics. I mean, I watch from afar, but I can just sense that same level of like admiration for people committing to their art. And obviously, I think of any performance as art, right? So whether you're an athlete, content creator, creating videos, all of it is something like that really just shows how much you've been working hard, and sharing that with the world is such a beautiful thing. Thank you so much for joining me today. Where can people go to get the book? Where can they go to stay connected? Tell us all of that, because we'll be adding that to the show notes too.
Yeah, so my book, All About Allergies, is found pretty much wherever you get your books. So whether it's Barnes & Noble, Target, Powell's, Books A Million, Amazon, your local bookstore, many indie bookstores are going to be carrying it. Many people have been requesting their libraries to get it too. So, you can always check it out from a local library. It's really anywhere. You can Google All About Allergies by Zachary Rubin, Dr. Rubin. I'm on basically all the social media platforms. Most of the handles are the Rubin_allergy. There's a few differences. I have a link tree too for people if they go to my TikTok as an example. But I'm just here for everybody. I'm here to help educate, demystify things. There's a lot going on in the world right now, but I'm happy that you and I are charging the way to help with providing good information.
Thank you for being in that support team. I love following you. I know if people who are not familiar with who you are, they will be following you now. And get the book. And thank you again for joining me today.
Thank you again for having me.
And for everyone tuning in, please, if you love this conversation, share it, subscribe to the channel, and also comment below on what questions you may have about allergies. It may be something that I do for a future video, grab a specialist back in on my show, Dr. Rubin back on my show, because that is what my platform's all about. Is if I don't know that information, I want to find someone who can help us get that information. And I'm just so grateful for the team of experts that have all come on the Peds Doc Talk podcast, including Dr. Rubin. Thank you all so much, and have a fantastic week ahead.